Welcome to Sharing Success from JSA. For over 50 years, we've helped agents and brokers compete and win at the highest level. Now we're taking it further, bringing you the strategies, insights, and conversations driving real growth in today's market. This is your blueprint for success. This is Sharing Success Together.
Well, hello, everyone. Thanks for joining us. Chris Hagestrom here with JSA, and I'm joined by Adam Wasmund, our Chief Distribution Officer. And this is the official kickoff of our Grow Your Business series here at Jack Schrader & Associates. We're going to be spending the next couple of weeks going over a lot of different topics, all focused around one thing, and that's how to grow your business as an independent agent and agency working in the Medicare health and life market. There's a lot of things that we're going to cover over the next few weeks, including how to diversify your product portfolio, how to utilize technology, marketing tips and tricks, including both digital and in-person events, all different kind of things that are all designed to support your business and give you a leg up in increasing revenue, increasing client satisfaction, and increasing overall success in the marketplace. So with that, Adam, there's a lot to talk about today. There's been a lot going on in the market. There's been a lot of challenges and changes specifically in Medicare. And just briefly, what are some of the biggest challenges that we're seeing in the Medicare space today?
Well, thanks, Chris. And yeah, this is kind of a crazy time that's happening in our industry, and it's not anything new. It's something for anyone who's been in the Medicare industry, health industry, life industry, just working with consumers in the industry. There's so many changes that have been going on, and it's not new. It's something that's been happening. It's something where we do have to, as you said, diversify. But what that really means to me is making sure that you as an agent are being financially protected, financially protecting your own family, financially protecting your consumers. With the changes that are happening, whether it's Medicare Supplement and Medicare Advantage, if we just focus on that for a second, between rate increases, between commission decreases, non-commissionable suppressions, products leaving the marketplace, there's a lot that happens, and in turn, we have to make sure that we're prepared for what's happening. When we look at the Medicare Supplement, just for starting points, this all kind of started with COVID. Yeah, and COVID. I know a lot of people are sick and tired of hearing about that, and we're 6 years after it. But what COVID did is it started to cause where consumers weren't going in to get services that they otherwise would have in other years. It really had to be emergency situations, COVID situations, but you weren't going in for your routine procedures.
Nope.
And what happens when we look at the Medicare Supplement side of things, and these companies were not naive to the fact that even though you don't have as many claims coming in because people aren't having the services done or weren't just able to have the services done, medical costs were still going up. And it's something where it doesn't matter how much you utilize it, it's cost of living. It's just like anything. Everything goes up every year.
Yep.
And when these carriers would go to states to ask for their rate increases, that even though they may not have been able to show the losses that specific year, they knew it was coming because of the increase in medical costs, because of the pent-up aggression of having services done, where it took 3 years before the states would allow them to take the rate increases that they needed.
Yeah, I've seen some data that has come out from Telos Actuarial where from 23, 24, and 25, the average per member per month cost to the Medicare Supplement carriers increased an average of 11% per year.
Yeah, and you think back from 2020 to 2023, these carriers were lucky if they could get a 5% increase because it just wasn't there.
Yep.
But they knew they had to. So now what's happening is a lot of the smaller carriers were so far underwater they couldn't withstand it, and we do see Medicare Supplement companies pulling out of the industry. I shouldn't say pulling out of the industry; they're not getting rid of their membership, but they're no longer selling.
Yeah,
they're looking at saying, "Listen, we can't afford this anymore. We're going to have to manage what we have and do the best we can with it." The national players, they were able to bleed it for a couple of years, but this year, 2026, we're going to be expecting to see for any of the carriers that had products available last year, we're looking probably anywhere from, again, a 12 to 25% increase depending on state, depending on the plan. And that's just companies trying to get back to where they need to be.
Yep.
There's still how much profit carriers can actually earn. So it's not something that they're trying to turn a 50% profit. But they do have to get right around the 86, 82% loss ratios. And right now, some of these companies are close to 100%, 102% loss ratio, which no company can withstand that. So, what we're seeing is we're seeing a correction with premiums, which is going to continuously happen. We're seeing, the other big thing is birthday month rule, which makes sense in some situations, but it also, it's that kind of issue or the take a paintbrush, the largest paintbrush you can, and do a streak across and make this change for everybody. And what we don't necessarily pay attention to right away when this is happening is cause and effect. What happens when this happens?
Yeah, it instantly turns those states into churns.
Yeah, and now you have situations where when carriers could predict or anticipate when a member joined their plan, they would get 4.5, 6.5 years of that member with the plan, where you can take a couple losses a few years, but you're going to make it up eventually. With these birthday month rules and being able to switch plans without underwriting, it causes this situation where there's really no loyalty to a carrier. No. And it does go down to who's the least expensive plan out there. And it takes, the risk and places on the carrier where they weren't able to control it as well as they used to in the past. So we saw a lot of states in 2025 add that. I would anticipate we're going to see more states do that.
Yep.
And what happens then is, one cause and effect is, all right, carriers can't predict loss ratios, but now what happens is carriers start reducing commissions. It's something where they have to make sure that they're protecting the consumers that have already been part of their program.
Yep.
And make sure that they're servicing new clients that come in. But at the same extent, when you're not going through that underwriting process, when you can't at least have some kind of sense on what type of membership you're bringing in, it causes larger increases and it lowers commissions. And that's unfortunately the state we're in, which again goes back to your earlier opening points of, making sure we're diversifying. And again, that goes down to protecting you financially, protecting a consumer financially. It's something where, we very well could see high deductible med sup plans become more prominent, and then bringing in secondary plans such as hospital indemnity or cancer or critical illness plans to help satisfy and offset some of those larger costs, but put some of that risk back on the consumer for in turn for that lower premium. The problem there is you go down that path is it's hurting you financially, us as agents financially, because a 20%, 25% commission on $70 a month, it's very little. And it's not saying that we divert and not do that option, but when you look at those options, there is a financial risk to consumers, right? So you're looking at a $2,000 deductible that the consumer needs to come up with before they're having coverage. And in turn, how do we offset those costs? And there's products out there that consumers can make sure they're financially protected. And it's something where I believe and we haven't got to the MA side of things yet, but what's happening in the Medicare market, Medicare Supplement market, and what's going to be happening and what is happening with the Medicare Advantage market, I do truly believe this is kind of history repeating itself from COVID in a different facet. And what I mean by there is you go back to 2018, 2019, and Chris, you and I have laughed about this numerous times about, we had so many individuals that worked with us across the country that we would bring new tools and resources, new technology to them to help them grow their business and do business a lot easier and smoother. And that was in the form of electronic enrollments, right? And you and I can remember back, and some of you may be chuckling saying, yeah, I might have been that agent, that it was like dragging someone through the sand, kicking and screaming that I don't want to do electronic enrollment, I want to do paper enrollment. But you know what COVID did is COVID forced that hand. It forced the agent to go to that digital route. And what I found, and even feedback I heard from agents that I speak to, and just the general census, is a lot of those agents that were kicking and screaming along that way from 2015 even all the way to 2020, are the same agents that within 3 months came back to us and said, "Why didn't you tell us about this?
How come I haven't been using these?
Why haven't you been telling me about this? So I could have
forever?"
been using this. This is so great." And we started laughing. We're like, "We've been telling you about this.
We've
you
been
just
telling
didn't
you for
want
a
to go
long
about it."
time.
So I say that because, with the changes that are occurring, it's kind of that same concept where it's forcing the agent's hand to truly do those risk analysis.
Yes.
Truly get past that one product. I'm talking about this one situation with you, and I'm not going to help you or talk to you about anything else because I'm scared about it.
Yep.
Yes, there's some fear in it, and you have to make sure you're educated and trained on it, but that's what we're here for.
Yeah,
right?
exactly.
So we're here to make sure, as your teammate, to make sure that you're educated, make sure that you have the products that are out there and the most competitive products that are out there, and products that are truly stable and are going to be around for a while, and organizations that when a claim comes through, it's not going to be a nightmare for a consumer to try getting that money or try getting that claim paid. Mm-hmm. It's something where you go back in early 2000s, you used to vest companies, make sure that there were actually the companies that are doing business right.
We still get those questions to this day. We have probably over 130 different carriers that we partner with, and we still get questions to this day. Well, how come you don't have ABC company? How come you don't have XYZ company? And it comes down to we're doing our research.
Yeah.
We're meeting with them. We're looking at things that are set online reviews.
Mm-hmm.
We're looking at industry experts, people that we partner with. And we take all that feedback into account.
Yeah, and that's not saying that just because we don't work with a carrier, it's not a good company. That's not the case. But Chris, to your point, we're looking at these carriers and we're making sure that we know what we're getting ourselves and getting you as the agent involved with before we jump into that and do contracting. Mm-hmm. And we have to also make sure that there's enough appetite out there from agents and from consumers alike. To make sure that we're upholding what we have to go to the table with these carriers with. Mm-hmm. So, and then if we go to what I mentioned earlier about Medicare Advantage, for anyone who's working in Medicare Advantage, we've known for the past 2 years it's been a very struggle AEP. This past AEP, there was a lot of SARs happening. Mm-hmm. There was some suppression. There was a lot of non-commissionable plans happening and things to that extent. From all indications, I've met with a lot of different carriers out there already for this first quarter, if not close to all of them that we work with. And we probably have another AEP that we're looking to go through the same type of scenario. And it's market correction. It's coming down to, for years and years, and I mean, go all the way back to 2005, 2006 with private fee-for-service plans. Throughout the past 20 years, it was all about the quantity I can get. Not necessarily the quality, but how many enrollments can I get? How much market share can I get?
Growth was always the goal.
Growth is where it was. So that was the main focus of everybody, right? So now what's been going on over the past couple of years is you have star ratings that are a big deal. Mm-hmm. A lot of people are looking at, I don't understand star ratings, or what's the big deal about them, blah, blah, blah. Star ratings mean millions, if not billions of dollars to insurance companies.
Absolutely.
Like we're talking serious money. And it's not, the other thing to think about there, and people can look and say, oh my God, like all this money, they already have all the money. It's not that they're getting millions and billions that they just get to pocket. Those star rating funds have to go back into the plan. So it's actually enhancing their plans.
Yeah, in the form of benefits.
Exactly. So it's giving the consumer better benefits, stability, which is extremely important, allowing them to get out into other areas to service other consumers out there. Mm-hmm. And where this industry is starting to go is, again, the quality of business, not necessarily the quantity. And quality, what they're talking about is it's not, I need someone who doesn't go in for services. That's not the case. They're looking for individuals that are in the right plan.
Yes.
Do they have Medicaid and they're in a normal plan, or
do they have a chronic condition?
Do they have a chronic condition in the normal plan? Like, there are plans specifically designed for specific subpopulations. Yep. And that's so important that members are in the correct plan. It's so important that members are utilizing their benefits. A lot of people look and say, oh, well, these insurance companies don't want to utilize your benefits. That's not the case.
That's not the case.
They need consumers to utilize their benefits. They need consumers to go in and get their wellness checks. They need to go in and get their screenings, get into wellness programs, get into mental health programs, get involved with their community to keep them mentally engaged in society, so other conditions don't happen. And just in general, just making sure they're treating the conditions they have and not letting them get out of control. So when that happens, now they're looking at what kind of business is coming in and what's happening. And, one big thing we saw this past AEP, and, it's, again, this is not a big brush stroke statement, but we saw it with some of these carriers where they started going in and getting rid of call centers. Some of these call centers, not all of them, there's some very good call centers out there, but some of these call centers were not doing the right thing. They were doing the quantity, not the quality. They weren't doing the risk analysis. They weren't making sure all the doctors were in networks. Or maybe they were, but they just weren't knowledgeable enough about the local marketplace. So we see that getting cleaned up there. And the other thing I see happening, and this is just my opinion from being in this industry since 2001. Chris, you can remember this, but I do again, I used this statement a little earlier, but I think history is repeating itself. We see what's happening with Medicare Advantage, and the plans that are getting kind of squeezed or pressured right now are PPOs. So if we think about that, and why I say history is repeating itself, and everybody's, I wouldn't say everybody, but there's a lot of people concerned about, oh my gosh, Medicare Advantage is going to go away, and what's going to happen? These carriers are going to tank, and that's not going to happen. I mean, it's such a huge penetration in the Medicare marketplace already as far as how many people are in these plans. They're not going away. They're making sure they're tailoring their plans to something they can manage. And what's happening is, when Medicare Advantage made their push across the country, it wasn't the start of it, but when they made the push across the country, it was private fee-for-service. Private fee-for-service for 7 to 10 years of just straight private fee-for-service. And what do we see now? How many private fee-for-service plans do you know out there?
Very little.
Maybe 5 plans across the entire country.
I can count on both hands,
maybe 12. But it's the same thing, right? So the private fee-for-service model was great. It was a great way to get people used to and comfortable of this type of insurance. But it wasn't sustainable because you didn't know where consumers were going. They could be going to a doctor that maybe had a lot of fraud. Maybe they were doing a lot of a waste services, going to DME facilities that were charging them for a wheelchair when they never even needed a wheelchair, but because they had a condition, they still billed the insurance company, right? So what's happening, in my opinion, again, this is just my personal opinion, I think we're in a portion or a time frame of this industry that the same concept is happening that happened to private fee-for-service is happening with PPOs. When you think of a PPO is open network. You have in-network, you have out-of-network. HMOs are in-network. Well, let's just use common sense here. HMO or PPO, which should have a better benefit? HMO. You control your costs. You're limited on where you can go for a provider, but at the same extent, the insurance company is able to know who you're going to see, or they're able to get the care coordination in there to make sure you're getting the services you need and so forth through. PPOs being that you have greater access to services outside of the control of the insurance, you should have lesser benefits. Not that you don't get the same services. It's HMO, you should have $0 on a PCP. PPO, you should have maybe 0 on a PCP, but if you go outside the network, maybe it's $50, whatever the case may be. And for the past 5 years, and this doesn't go for all areas, but for a lot of areas across this country, PPOs were better benefits.
So
how do you do it?
It mirrors.
It doesn't make sense.
It mirrors exactly what happened with private fee-for-service. Now that I think about it, because private fee-for-service was used to take an insurance company's products and spread out to as many counties as possible. So it was casting the widest net. And then when the private fee-for-service plans were running into issues, when the fraud was coming up, when the carriers couldn't control costs or anything, you saw those private fee-for-service plans contract, but then you saw these local PPOs pop up.
Correct.
So you still had your core HMO markets.
And you had HMO point-of-service plans pop up.
So you still had some flexibility, but it was much more concentrated. And then, just like the private fee-for-service plans, all of a sudden PPOs were everywhere. And they spread out to cast the widest net. And we're seeing that contraction again. We're seeing the PPOs go non-commissionable. We're seeing them leave markets. HMO plans are still HMO plans.
Yeah, they're the most stressed when you look at financials. just like Medicare Supplement, only more restrictions. You can't make 50% profit.
Nope.
Like your profit margin is very slim when it comes to what you're able to do. And I do, again, 100% Adam Wasmund opinion. It's not a JSA opinion, not a AmeriLife opinion, not an insurance company's opinion. It's just what I've personally seen in being in this industry. I do believe we're going to see, especially this coming up AEP, I think we're going to see a lot of PPOs be a SAR, a service area reduction.
Yep.
I think we're going to see a greater focus on HMOs.
Yes.
Where a PPO is going to be offered, or if a carrier offers a PPO, I think they're going to finally try course correcting their benefits, meaning the consumer will have a very strong, more rich benefit on your HMO versus your PPO. And they're going to make sure that, hey, we want to make sure that you consumer have what you want, but you need to truly choose, what are you looking for?
Right.
What do you want to protect? Insurance isn't for, oh, I want a golf membership, or I want XYZ add-on benefit that was part of my plan. It's not health insurance.
No.
Like, we don't buy cars that way. You buy it off of what your need is. If you have to tow something, you're buying a truck. If you want fuel efficiency, you're buying an electric car or a hybrid car or something to that extent. Same concept. It's making or trying to make the consumer truly take ownership in their health, take ownership in their decisions, and say, you know what, my largest concern is my diabetes. My largest concern is being able to see my specialist. My largest concern is I'm a snowbird.
Yep.
Or I travel a lot. That's what I enjoy to do in my retirement. So it's making somebody actually take kind of responsibility and say, okay, I don't really necessarily care about all these add-on supplemental benefits. They're nice to have, yes, but what is the true, what's the true need of my insurance?
Right.
What am I truly looking for in a core benefit?
Yep.
And how do you want to have that played out?
I think
that's where I see this industry going.
I think it's going to be, to boil it down in the most basic terms that you possibly can, I think it's going to come down to eventually Medicare Advantage. The landscape will look like, well, what do you want? Do you want coverage, or do you want options?
Yep.
And I think that's going to be the two biggest differentiations. If you want coverage, HMOs are going to have your best coverage. If you want options, if you want to have flexibility to go to different providers and specialists and centers of excellence, then the PPO is going to be available. And I'll take it a step further. I can even predict some PPOs carrying a premium.
Oh, yeah.
In the very near future.
Yeah. I mean, well, and
to pay for that flexibility.
So yes, I would agree with that. The other thing I would say is, when carriers, and this is probably way too much information for everybody, but
a little bit of inside baseball here.
Yeah, I mean, so when a carrier goes through what they call the bidding process, that's the process that they go through to either A, design a plan, or B, tweak their plan from year over year. It's not something they can go through and just change the entire look and feel of a plan.
No.
They're only allowed so much per member per month of dollars that they can change. Now, it's not equivalent. $1 for dental is $1 per member per month. Each thing is valued and weighted differently, but there's only so many dollars that they can change in their specific plan before they have to release a new plan.
Correct.
So that's another reason that we saw SARS happen, is their plans were so far out of whack that to get it back to where it needed to be, it would have to be a complete overhaul, and they legally can't do that. So now what happens is you have to terminate a plan and release a new plan.
Or some carriers release those lookalike plans and then made their legacy plans non-commissionable.
Correct.
That's that practice in action.
Correct. And that also, I mean, who knows why they did it? There's plenty of different factors that go in. It could be something that they're looking at, saying, hey, we want to make sure that our existing members are going to be stable, and we want to be able to offer that. We just can't allow new membership into it.
Yep.
And that's how we're going to stabilize it, to make sure that they get the star ratings and the claims aren't astronomical, and we can hold it together. And we're going to release this other plan that looks just like it, but to allow new membership in, so you have a new loss ratio side of things.
Yes.
So, yep.
Now, when it comes to looking at the landscape, and of course we know this next year's AEP is going to be a little bit tumultuous, like we've seen the past couple of years. What can agents do now to prepare themselves for this upcoming AEP?
A lot.
I know it's kind of a loaded question, but
yeah, no, I mean, quite a few different things. And we talked about this in the past. One, making sure that you have the plans that are available in your area. And it's not saying you have to go through and contract with everybody, but make sure you have a good selection. Meaning, if you're only working with 1 or 2 carriers, I would suggest picking up 3 or 4 carriers. Like have a core 4 to 5 carriers that you're working with. A lot of people are always concerned, or they don't want to have all the extra certification that goes involved. But realistically, in today's age, it's become so streamlined. You got your AHIP, you have other national certifications, and then from there it's hour per product.
Yep.
It's not that drastic or as bad as it used to be. So one, I'd make sure that I have the products that I need to have. That's not saying that those 4 go, that they're all going to be there and they're all going to be the most
exactly
cost-effective plan for a consumer, but it'll give you a good base.
Yep.
Number 2 is, and I'm sure a lot of people are sick and tired of hearing it, but making sure you have other product lines. And that goes as far as, dental, vision, hearing. That goes to hospital indemnity. That goes to cancer, critical illness, final expense, life products, annuity products, Medicare Supplement products for that matter.
Yes.
It's not just MA during AEP that you have to worry about. It's Med Sups also. And you have to make sure that you have that portfolio of products and carriers to make sure, that you're able to offer your consumer something that's financially valuable to them. But 2, also making sure you're protecting yourself. The other big thing that we didn't talk about changes that are coming or could be coming are new proposals that are out there. And one specifically is the possibly new SEP that the government wants to release when it comes to providers and Medicare Advantage plans. You look at that and some people would look and say, well, that's great. If a doctor leaves the network, a consumer should be able to switch a plan and or if a hospital does or whatever may happen. Yes and no. Again, that's the risk you take with Advantage,
that's
right?
One of the trade-offs.
So you want to see any doctor you want that bills Medicare, no questions asked, doesn't matter what happens throughout the year. That's Med Sup.
Yep.
But you're going to have to pay for it.
Yep.
Right. So average premiums right now across the country, you're looking at about $1,800 to $1,900. You can get lesser plans, but realistically, I've met with a lot of Medicare Supplement companies again already this year, and with where medical costs are at, you got to get approximately $1,800 for $1,750 for a female and about $1,950 for a male. So you're on average $1,800 right there. That's realistic. That's today's age. That doesn't include your Part D. You want a $0 or very low dollar monthly plan premium? That's the risk you take. Is you're offsetting that upfront fee, but you're now tied to a network.
Yes.
The problem with the SEP when it ties to doctors, and I don't think a lot of people truly think this through all the time, is think about what even happened this past AEP. And it didn't happen all across the country, but it happened in a lot of major areas, a lot of major states, is you have hospital systems or doctors, that is the time that they start negotiating with Medicare Advantage companies saying, hey, you XYZ carrier, you have to pay me 105% of what Medicare says or I terminate my contract. And the insurance company comes back and says, well, we're not going to pay you 105%. We'll give you 98%. They're like, well, we want 102%. Well, during these negotiations, what happens is doctors and facilities have a leg up on an insurance company. And it's really simple. I'm sending out a notice to all my members because I have to give them a 90-day notice.
The PR battle starts.
About as of 1/1, you will no longer be able to see us for coverage if you have XYZ carrier. And what that does is that creates this negotiation tactic where now they're battling. And it didn't happen in all situations, but most of the time, right around the end of November, guess what? There's no negotiations, got settled. They're still part of the network. Yeah, doctors are happy. Insurance company may not be happy, or maybe they are happy if they were able to negotiate down. But member went unaffected. The difference being is that member was notified throughout AEP.
Correct.
And then what that does is that causes confusion. It causes fear, turmoil, and it causes a lot of consumers to start looking and switching what plans that they're offering, right? So think about that. Right now, we only have an AEP window that happens. You start allowing this concept of if a doctor, or if it doesn't even say a doctor, if your provider leaves a plan, you get a SEP.
Yep.
What does that do? That creates a negotiation tactic for the entire year.
Yes.
And that only will cause more confusion, more disruption. And it's not saying, oh, it's going to cause confusion and disruption for an insurance carrier or for that provider. It's concern, fear, and turmoil for that consumer because they never know if they're even going to be safe throughout that year.
Yep.
And the worst part about it is they don't even have it defined on what a provider is. It could be a chiropractor.
Nope.
Oh, your chiropractor left. Or what justifies, is it my provider? Did I have to see them within the past 90 days, 60 days, a year? That, again, starts adding, and some of you listening may look and say, well, what difference does it make? Well, because by doing that, if you have to pay more to a provider for your services, that increases your medical loss ratios, which then in turn increases or decreases, I should say, the benefits the consumer is receiving. Because again, you can't be even over 95% loss ratios as an insurance company. You can't do it.
No.
It's not realistic. Just like any business out there. If you're in XYZ industry of selling soap and it takes $1 to make the soap and I'm only selling it for 80 cents, well, I'm not going to be in business very long.
No.
Like, it doesn't make sense at all. So it's something where in some aspects, yes, I understand it. I understand that if I have a cancer and I'm actively having cancer treatments, and for some reason that provider leaves the insurance network mid-year, and all of a sudden now what am I supposed to do? Try finding another cancer place? No, like I have full sympathy for that. And there can be solutions for that. It's just there's not the solutions there yet. They have to really think this through because it's not this broad stroke where it's, oh, well, like I said, chiropractor leaves. Like, that shouldn't qualify for you to be able to switch plans mid-year when it comes to Medicare Advantage.
The proposed rule even had an aspect in there that said the insurance company has to send a notice out to their members that their doctor is leaving their network, and also include information about Medicare Supplement rights.
Yep.
So there's even this little piece in there that points to, well, they may change guarantee issue rules around that too. Because I know there are some situations, like in Pennsylvania right now, one of the big networks is leaving United Healthcare, and the state has granted a guarantee issue period for people not just to change their Medicare Advantage plans with an SEP, but to also get a Medicare Supplement guarantee issue. So now you have those battles that spread out and affect the risk of other products that are out there.
Correct. So I mean, is there things that need to change? Yes, absolutely. I really think a broad stroke aspect to this, which unfortunately is kind of how things happen. Politicians don't like getting into details.
Nope.
They like just doing this general
feel-good
message,
stuff.
and then from there it's, well, what does this mean? And well, there's no definition to what that word means. So how do we move forward? And again, it just causes confusion, turmoil, and disruption. So yeah, that's what I feel is happening this year, which is, it's interesting and unfortunate in a lot of situations, but to the same extent, if we go back to what we stated earlier, I think it does have a positive outlook for consumers and for agents. And what I mean by that is not all the disruption and what's happening, it's forcing all of us to really take a step back, look at the products that are out there and say, am I doing my customer justice? And that's us saying that to our customer, which is the agent. It's you, agent, saying that about your customer, the consumer, saying, am I doing my customer justice, and am I showing them all the options that are out there, even though it may not be a prominent part of my business? Am I making sure that they are aware of the aspects that are out there? I'll use my own personal situation, which is very eye-opening. And again, why I was saying that is I believe the changes in the industry is forcing individuals to start thinking that way. I had some very dear friends that were in a horrific accident, not due to their own, and it was tied to somebody else. And I started thinking, I'm like, boy, if that happened, like I have a boat. If I'm on my boat and I get in an accident, or somebody accidentally hits me, or for some reason it takes on water and it sinks, or somebody gets hurt on my trampoline. They can come after you for almost anything.
Yep.
And I started thinking about that. I'm like, well, I got homeowners insurance and I got car insurance, I got boat insurance. And I started thinking, I'm like, all right, well, I'm good. Well, I actually talked to one of our agents, who ends up being my agent now. And he looked at me and said, Adam, you need an umbrella policy. I'm like, well, I don't even know what an umbrella policy is. He's like, well, in case somebody sues you, you're covered. I said, what do you mean? I got my homeowner's insurance. Like, what are you talking about? He's like, listen, first thing, if somebody hires an attorney, the first thing they're doing is they're looking up assets. What do you have? You have a boat? Cool. We're going to go after him for the entire boat. He has a house? Cool. We're going after him for the house. He has a car? Cool. I'm going after him for the car. And it just financially protects you at that point. And you start thinking about that. You're like, man, if that wouldn't have happened to my dear friends, where they had to unfortunately get an attorney and sit there and try figuring out how they're covering all these medical costs. And it's not anything like I don't even know the right word, but going after them like, oh my God, I'm going to sue you.
Malicious, yeah.
Malicious, thank you. It's not being malicious, saying, oh yeah, I'm so happy, I'm going to come after you. It's not that. That's what we have insurance for, right?
Yep.
And yes, I'm using this in a different context of what we're doing, but it is the same type of situation. If we're not making sure consumers have what they need, why are we doing this? Like, we're supposed to be the experts that are telling a consumer and educating a consumer on what their options are. If you get cancer, is all your cancer bills being covered by any healthcare? Absolutely not.
Nope.
That's the most ridiculous statement somebody could ever make.
Well, I have a Medicare Supplement
Doesn't
plan.
matter. It's not covered. Like, yes, some things are covered, yes.
Yep.
But there's a lot of money that's indirect medical needs, which are not covered by anything. It doesn't matter. And, it's the type of thing that when something happens is when a lot of people think about it and they say, boy, I wish I would have done this.
Yeah, what's the old adage? Don't buy car insurance after your first accident.
Yeah, which also was an interesting factor. It had that happen to somebody I knew too. They got hit, and the person that hit them, unbeknownst to them, gave them their insurance information. Well, 3 weeks later, they're going through the insurance process. The insurance company from the other people came back and said, what time was that accident at? 11:53? This policy was issued at 11:57. They called at that accident and put insurance in place. Like, that's not what insurance is for.
No.
Like, we have insurance.
You prepare for
to make sure that we're preparing ourselves, that we have the abilities to get the procedures, the services, the treatment that we need to continuously live healthier, longer lives.
Yep.
So
absolutely. And our agents have to be that guiding light. They have to be the ones that are talking to their consumers, that are letting them know about these gaps in their coverage, that are letting them know about the risks that still exist out there, even with a Medicare Supplement plan. It's important that we're the ones that are educating those consumers on what the risks truly are, kind of getting into the weeds a little bit about the coverage that they have, and making sure that you're notifying them, that we're telling them about all these different coverage options. Because there's a lot of other products that are out there and products that have been around for a long time that never seem to enter the conversation for a lot of Medicare beneficiaries. And it could leave an agent exposed. It could leave them in a situation where they're not bringing up things like hospital indemnity plans or dental vision hearing plans or cancer coverage. And all of a sudden, their client calls them up one day and be like, how come you never told me about this? I'm sorry, I'm done working with you. I'm going to go work with another individual. Yeah. We're getting to that point in this marketplace with all the changes happening to the Medicare Advantage plans, with all the changes happening to commissions, with some carriers even reducing those true-up commissions for sales made throughout the year. All signs are pointing to diversification. Absolutely. It's the entire market is heading that way. I think Adam and I have spent the past 40 minutes talking about how everything is really pointing to now's the time to diversify. It is. Now's the time to take that business to the next step. And that's why we're doing our Build Your Business, how to grow your business over the next few weeks is to talk about those things, is to open your eyes on the other products that exist out there. Open your eyes to things like digital tools that a lot more agents are adopting to this day. And I think it's important that we get this message out as soon as possible.
Oh, absolutely. And you talk about, your question to me, which I have squirrel moments here and there, and I go all over the place. But your question to me originally was, what should agents be doing to prepare? Is making sure you're contracted with all the different products, but more importantly, making sure you're educated on what that product is and how to position it so that your consumer can understand what that product is. It's training, it's education. If you're anything like me, it takes hearing something 3 or 4 times before it really settles in your mind to be comfortable talking about it. So now's the time that you need to be sitting here doing your research, doing your education, listening to the different trainings, going to the different events that we're holding, using the resources, using the tools that we have available to you so that you are comfortable when this next AEP comes, and it can be even throughout the rest of this year. There is no time frame with these other products.
Nope.
But making sure you're getting in touch with your consumers, setting up business plans that you're able to connect with your members to make sure that they're truly understand what's available.
Absolutely. And it does, when you diversify and you look at these other programs, it opens up, Medicare, we all know Medicare, we have AEP, and then we have SEP for the rest of the year. Those other products open up opportunities to continue to serve not just new clients or new people to you, but your existing book of business throughout the entire year, and give you an opportunity to have those conversations, do that education. And now would be a great time to look at your portfolio, look at the opportunities you have, and get to work on a couple. Reach out to your Medicare Advantage members and talk to them about hospital indemnity plans. Reach out to your Medicare Supplement clients and talk to them about life insurance. There's a lot of opportunity and things that we could do now. So as we get into the annual enrollment period and you start having those annual reviews, or you deal with those squeaky wheels, those clients that are losing their coverage, you can have a conversation about their new Medicare options, but also, hey, we need to talk about how we're going to cover the gaps in this Medicare Advantage plan. And you can do that all during the annual enrollment period.
Yep, agreed. So,
yep, great opportunity. So with that, stay tuned. Watch what we're doing over the next couple of weeks. We have a lot of great trainings that are coming your way, a lot of insight, a lot of how-tos. There's a lot of materials and things we're working on to help make this process easy for you to not only learn about the plans, learn best practices with those plans, but to how to have those conversations with your clients. So with that, thank you, Adam.
Thank you, Chris.
Any final thoughts?
I would say my final thought is, even if you do believe that you're really in a good spot with what you offer for your consumers, reach out to your sales team here at JSA. Let them just take a look at what you're doing. Even if it's not all the plans or products are through JSA, just let's have a conversation. Let's go through your specific area, have that conversation, and just make sure there's not something out there that maybe a new carrier or a new product that came out that you weren't aware that's there. So my last words would be, take the time, reach out to our sales team, make sure we're building continuous relationships, and anything we can do to continuously help grow your business, we're here for you nonstop. So
absolutely.
Thank you, everybody.
Absolutely. Thanks, everyone. Take care.
Appreciate it.